back. The time's now 9:23. Experts say the number of children who went to the emergency room because of a battery-related incident has more than doubled in the last 10 years. Here now to talk about the dangers of batteries around children and how you can keep them safe is Dr. Reena Mehta. Dr. Mehta, good morning and thanks for being with us.
Good morning. Thank you so much for having me.
So let's break this down a little bit. I know the first thing people are thinking when they're thinking batteries are dangerous to children, they're thinking of those little tiny batteries that might go in the back of a watch or some other type of electronic. Let's first talk about the dangers, the hazards that come along with those batteries.
Okay, so great question. So a recent study published in Pediatrics, which is the journal that belongs to the American Academy of Pediatrics, showed that basically the number of emergency room visits from kids ingesting, which means swallowing batteries, has doubled in the last decade. And so the biggest risk when it comes to batteries are exactly what you said, those button batteries or those lithium batteries that are often tricky because they'll be in car fobs, they'll be in watches, they'll be in hearing aids, things that we use on an everyday basis and don't even realize that that could be putting a risk to our children.
And obviously there's the choking hazard, but what other issues could come with ingesting those little button batteries or those lithium batteries?
So when you ingest one of those batteries, basically what it does is it creates a current. A current is generated as soon as it hits bodily fluids. And so what that means is that it reduces something called sodium hydroxide or lye, which is corrosive. So basically it can create a hole anywhere down from where you swallow all the way through your GI tract. So obviously, if you can imagine, if there is a hole in your stomach or in your esophagus, that can pose a lot of health issues, and it could even be potentially life-threatening.
So let's start off with what we can do to prevent these issues. What is the best way to keep your child safe and protect them from swallowing and ingesting these types of batteries?
So of course, being aware that a lot of things carry these batteries. I mentioned a few, but children's toys, watches, hearing aids, key fobs, sometimes things that you wouldn't even expect. So being aware that batteries are everywhere and then treating those devices as if it was like a knife in the kitchen or cleaning disinfectants that you would use the same common sense that you would use for some of those products when it comes to dealing with batteries. And then of course, education, learning about it and then even educating older children to say, don't leave your things lying around, don't leave, these devices because then little Johnny or, your sibling can come into contact with it, eat it, and that could be a huge health hazard.
And what happens, or what should parents do, what should guardians do, older siblings do if they suspect a smaller child has in fact ingested one of these?
So the first thing is seek medical attention, call 911 or go to your closest emergency room because of course time is of essence. That once you eat one of these batteries, the biggest and most important thing is you need to get it out. However that may be, it may be a procedure that's done in the emergency room. It may be that it comes out the other end. But the most important thing is it's damaging. So getting it out as quick as possible. So seeking emergency attention. The other thing is if you're not sure, you can always call poison control or your pediatrician to get advice on next steps. But if you suspect that your child has ingested it, you need to seek medical attention.
All
There's
right,
also
doctor.
been some studies.
Oh, I'm sorry.
Some
We've run out of
studies
time,
that
but
show.
go ahead. Go ahead.
Okay. That if you suspect that your child is older than age 1 and has ingested a battery, you can actually drink 2 teaspoons of honey to coat the inner lining of the GI tract. So that just buys you some time as you're getting to the emergency room.
But still get to the ER. Okay, Dr. Mehta, thank you so much for those reminders.